Hello, I'm Dr. Jennifer Henry, a very proud alum of the Faculty of Veterinary and Agricultural Sciences. It's my great pleasure to join Associate Professor Gyorgy Scrinis, food, politics and policy expert in the School of Agriculture and Food, for a discussion about the science and policy implications of ultra-processed foods in an Australian and a global context. Gyorgy specialises in critical social science research that addresses the philosophy and politics of food science and agricultural technologies, and examines issues related to food security, health and sustainability, and corporate power and influence in the food system. Gyorgy lectures in food and nutrition, politics and policy in the School of Agriculture and Food. Gyorgy, in recent years there has been a great deal of interest and concern over the health impacts of processed foods. You've been researching this area for some time in Australia and globally. Tell us about your research.
So in this area, I have been studying the philosophy of nutrition science for some time, particularly looking at what I call nutritionism or nutritional reductionism within the science itself, and how that plays out in terms of dietary guidelines and food marketing and so on. And more recently I've turned my attention to studying processed foods, the nature of these foods, and also how these foods are being marketed, and also policy around processed foods. And I've also been working recently with a team in Brazil to measure the sort of quantities of what we're calling now ultra-processed foods are being consumed in Australia and around the world.
What's wrong with processed foods?
Most foods are processed to some degree before we consume them, so there's nothing wrong with all processed foods, but we are increasingly concerned about particular types of heavily processed foods, and particularly what we will be referring to as ultra-processed foods. And there is growing evidence about the health impacts of these foods. But unfortunately, we haven't really been studying processed foods for all that long. In previous decades, we've mainly been focusing on the nutrient profile of processed foods. And so there's been very much a focus on the sort of so-called good and bad nutrients in some of these foods. But because of that focus on nutrients, nutrition experts haven't really been developing classification systems for defining and categorising processed foods. And without that, we aren't really able to do the studies. So this changed about a decade ago when Professor Carlos Monteiro from the University of Sao Paulo in Brazil and his team developed a new classification system they call NOVA, which had 4 categories of processed foods. And the one we're particularly concerned about here is the category of ultra-processed foods, which is the more heavily processed foods. Now, there's still certainly debate amongst experts about the merits of this new classification system. But many research teams around the world now are using this classification system to study the dietary and health impacts of ultra-processed foods, and really starting to show some of those associations with health outcomes.
Tell me more about the collaboration.
I've been working with Carlos Monteiro's team to measure and analyse ultra-processed food consumption in Australia in a project that looks at ultra-processed food consumption across 7 countries.
What is the definition of ultra-processed foods, and what kinds of foods are we talking about here?
So ultra-processed foods are usually ready-to-eat foods that are formulations of a whole range of fairly highly processed ingredients and additives. This includes cosmetic additives, which add colour and flavour and texture to foods. These foods also tend to be quite high in salt, sugar and fats, those nutrients we're not supposed to overconsume, but that's not really a defining characteristic, because many other foods, even home-cooked foods, can be high in salt or sugar. What really defines these foods is that they contain ingredients and additives that you wouldn't actually find in your kitchen, and you wouldn't use in your home cooking, nor in an artisanal restaurant or even an artisanal takeaway place. So they really are foods, almost by definition, that are produced by large-scale food manufacturers and fast food companies. And they include foods like chicken nuggets, margarine, certainly confectionery, sugar-sweetened beverages, but can also be processed meats like hamburgers, sausages and so on. But even bread can be ultra-processed if it contains certain additives, and that's where the definition really comes back to what are the ingredients and particular additives in these products. They have other characteristics too, other than their composition. It's also about that these foods that tend to be very heavily marketed by companies. They're often very cheap and affordable and very available. You find them everywhere to purchase. And all these characteristics, both the ingredients and the sort of marketing and so on, all encourage the consumption or even the overconsumption of these foods. And really that's where they're very much a product of food corporations, and their impacts are a product of the way in which they're produced and marketed by these companies.
How much ultra-processed food do we eat in Australia, and how does that compare with the rest of the world?
In our studies of the Australian diet, which were led by Dr. Priscilla Machado, we found that on average Australians consume 42% of their diet is ultra-processed foods.
42%. So how does that compare with other countries?
Well, by comparison with other high-income countries, United States sits at around 58% of their diet is ultra-processed, the United Kingdom around 56%, although some other high-income countries like France and Spain have lower levels of ultra-processed food consumption than Australia. In France it's around 27%, Spain around 32%. By contrast, again, low and middle-income countries have much lower consumption, as we might expect. So Brazil, for example, has on average 20% ultra-processed food consumption of their total diet. However, in low and middle-income countries, the consumption of ultra-processed foods has been growing quite rapidly over the past decade or two, with growth rates around 10% per year. So that's a real concern. And it's associated with what we call the nutrition transition in these countries. Now, these are average figures across the whole population within these countries, and it's interesting to compare different countries. But I think it's also interesting to look what's happening within countries across populations, and here we see great disparities which are of concern. So in Australia, for example, that average of 42% across the whole population. However, the top 1/5 of ultra-processed food consumers, they are the people who eat most ultra-processed foods within Australia. Around 80% of their diet is ultra-processed. And compare that with the lowest quintile, the bottom 1/5 of consumers of ultra-processed foods, only 17%. So that's a huge disparity within Australia, 17 up to 80%. This pattern's being played out all around the world, this variation. If we dig down deeper into the Australian figures, we find, once again worryingly, that children and adolescents are the highest consumers of ultra-processed foods in Australia. And there's also a socioeconomic dimension, that people on lower incomes tend to eat higher levels of ultra-processed foods. And that's a great concern when many of these foods are of very poor quality.
What evidence do we have about the impacts of ultra-processed foods on the quality of people's diets?
Well, first we need to acknowledge that ultra-processed foods take in a broad range of foods which vary quite a bit in terms of their composition and their quality. Nevertheless, our studies are showing that taken together as a whole, they are having significant impacts on our diets and also on health outcomes. Now, firstly, we can consider the nutrient profile of these foods and their impact on people's diets. And our studies have shown that those who consume the highest quantity of ultra-processed foods tend to overconsume those nutrients of concern like sugars, sodium, some fats and energy and so on. Now, while that's important to acknowledge that, the sort of nutrient profile, that doesn't tell the whole story. We're also concerned about the various ingredients in these foods and how they're being processed and what their health impacts might be. And as I mentioned earlier, a lot of these ingredients have been broken down and processed in various ways. And we don't yet understand the impacts of each one of those ingredients. But as a whole, we can see them having certain impacts.
What kinds of ingredients are we talking about?
So these include ingredients like soy, grains, sugars, even meat, but each of these ingredients has been broken down and processed in various ways. But what's missing in these foods is also important. The lack of intact ingredients, and particularly of vegetables, fruits, legumes, and even whole meats are missing from these foods.
So what do studies tell us about ultra-processed foods and overconsumption?
Now, we don't yet understand the health and dietary impacts of each of these ingredients yet. We're still at the early stages of that research. But we do think that overall these foods, in a sense, lack nutritiousness because of the way they're being processed. One of the dietary impacts, which has been shown in one study in particular, that these foods tend to promote overconsumption. because of the way they've been processed. So that's one concern. Another broad concern is simply the way in which these foods are displacing minimally processed foods from our diets. And these minimally processed foods, they're the nutritious foods that we're supposed to be eating more of according to our dietary guidelines. This displacement of minimally processed foods is particularly concerning in low and middle income countries where traditional diets and foods are being displaced by often fairly poor quality ultra processed foods.
What kinds of health impacts might ultra processed foods be contributing to?
Well, several studies around the world of various countries are showing an association between high levels of ultra processed food consumption and various health outcomes, such as higher risk of obesity, diabetes, heart disease, and cancer. There's even some evidence that ultra-processed foods might be contributing to some nutrient deficiencies. So overall, it's painting a picture of some of the broader health impacts that these foods are having. It's important to note that some of these studies are simply showing associations between ultra-processed food consumption and some of these health outcomes. So there's still further work to be done there. But it's not just in high-income countries, as we might otherwise expect, but with rising levels of consumption of ultra-processed foods in low and middle-income countries, we're seeing the same patterns of disease emerging there also. And in those contexts, some of these diseases are coexisting with older problems of undernutrition, and that's what we refer to as the double burden of malnutrition that exists in these countries.
What do you mean by the double burden?
The double burden refers to where communities face the problems both associated with undernutrition, hunger, nutrient deficiencies on the one hand, and those associated with what we sometimes refer to as overconsumption and the diseases of and chronic diseases like heart disease and diabetes.
Gyorgy, you mentioned that we shouldn't only be concerned with the particular nutrients in processed foods, such as sugar, as this might distract us from other characteristics. You've written about the problem with this extreme focus on nutrients, which you call nutritionism. Tell us more about how nutritionism has affected the way we understand processed foods.
Well, what I refer to as nutritionism or nutritional reductionism is what I think has been the dominant paradigm or the dominant ideology within nutrition science over the past century or so. It refers to where scientists themselves have fairly reductively focused on the nutrient composition of foods and also reductively interpreted the role of nutrients. And this means drawing fairly strong associations and claims about the role of particular nutrients in health and the role of so-called good and bad nutrients. Now, while there's certainly it's an important focus, it does tend to take the focus away from other characteristics of foods. In terms of ultra-processed foods, it takes the focus away from the ingredients and how they've been processed and what the health impacts of that might be. Now, food companies have actually been fairly good at exploiting this nutrient focus. They've been, over the years, been able to add or subtract nutrients, these so-called good and bad nutrients, from their foods and to market them in this way by focusing on the nutrients. In doing so, it tends to conceal the ingredients within these foods. So that's suited these companies well. And now, more recently, now that there is quite a focus on the high salt, sugar and fat content of ultra-processed foods, this also suits the food industry actually, because it means they're able just to reformulate their products and reduce the quantities of some of these nutrients, the salt and the sugar, for example, and present these foods as being, once again, healthful. But once again, that's ignoring, it absolves them from having to consider all the other ingredients and the way they're processed in these products.
Let's talk about nutrition labelling regulations.
Well, unfortunately, our nutrition labelling regulations allow companies to make essentially misleading claims by allowing them to focus just on particular nutrients in their products and to market those nutrients, ignoring the overall quality and composition of the foods themselves.
It seems that consumers are becoming much more sceptical about highly processed foods and are choosing what they think are healthier options.
Yes, I do think many consumers are becoming much more sceptical about highly processed foods, and particularly some ingredients and additives in these foods. And there seems to be, amongst many consumers, a movement back to eating more minimally processed foods, even minimally processed packaged foods and fast foods. And that's demonstrated. I think food companies are onto this and starting to market their foods, highlighting the presence of whole grains, for example, or the lack of additives. So this is a real movement that's happening, and consumers are trying to eat healthier. It's sometimes referred to as the real food movement, and certainly a whole food movement. This is certainly happening. However, there does tend to be a price premium for better quality foods. And this is where the low price and low cost of ultra-processed foods is a concern. It's a real driver of their consumption. And that's why it's got to be more than just the responsibility of consumers to choose healthier options. We really need to be creating a healthier food supply. And that means governments need to step in and create policies and regulations to promote a healthier food supply, healthier foods. And that really means regulating the products and the practices of the food companies that produce ultra-processed foods.
We've started to see governments around the world introduce policies to regulate some of these products and to improve people's diets, such as the sugar tax in Mexico and the UK and the Health Star rating system in Australia. How effective are these measures in improving the nutritional quality of food?
Well, it's worth noting, first of all, that it's taken a very long time for governments to begin to start regulating these products and these marketing practices. One reason for this is that food corporations themselves have been lobbying governments for many years to prevent them from introducing new policies and regulations, and they're still doing so today. But another also is that the lack of scientific evidence that we've had, at least until recently. But now, particularly in the past decade, many governments around the world are starting to introduce some significant new policies and regulations. And not just in high-income countries, also in low and middle-income countries who are really leading the way in some ways. And now this includes front-of-pack labelling regulations like the Health Star rating system you mentioned, the traffic light labelling system in the United Kingdom, and also the black stop light regulation in Chile. We have sugar taxes in Mexico and now also the UK, and also some restrictions on marketing to children in some countries. Now this is all a good start, but we have, I think, a long way to go. It's still the early stages, and I think it's fair to say we've entered a new era of nutrition policy where, and there's certainly many more developments to come in this space. Unfortunately, though, one of the limitations of the policies to date is that they've mainly just focused on the salt, sugar and fat content of food. So that's really what's been the focus of regulations such as sugar taxes. And it's trying to encourage producers to reduce the quantities of these nutrients in their products, and also to try and get consumers to reduce their consumption of these nutrients. But as I mentioned earlier, that's a limitation because it ignores the many other characteristics of these foods, both in terms of their composition, but also the fact that these foods are still fairly heavily distributed and marketed.
How are the large food corporations responding to concerns from both governments and consumers about these ultra-processed foods?
Well, food companies are responding. Indeed, they have to respond, particularly given these consumer shifts, consumers looking for healthier options. So just to keep up their market share and keep growing, they are responding in various ways, developing several strategies for nutritionally engineering their products and nutritionally marketing their products. One that I've already mentioned is that one of reformulation, and that is reformulating foods to reduce the quantities of salt, sugar and some fats. And food companies are actually now very enthusiastic about this reformulation strategy. And the reason for this should be fairly obvious, because if they are able to reformulate their products, they can encourage consumers to keep on consuming them, because the alternative is not that palatable to them, which is that consumers eat less of these products. So they much prefer to reformulate than have consumers choose to, or have policies brought in to reduce the consumption of these products. But other strategies they're developing are much more positive in nature, and they refer to where companies are adding beneficial ingredients to their products and then marketing their health benefits. And these take two forms, what I refer to as the fortification and the functionalization strategies. Now, fortification is where some micronutrients are added to foods, such as zinc and iron, and which companies have been doing for a very long time, but now companies are targeting these products at communities which are very vulnerable to having nutrient deficiencies, particularly in low and middle income countries. And they're using this fortification strategy as a way of driving sales up in those countries. The other strategy is the functionalization strategy, which involves adding ingredients or nutrients like omega-3 fats, antioxidants and so on, even whole grains, and then marketing the health benefits, the added health benefits that these foods might bring. And that all sounds fine, but except that by and large, these nutrients are being added to products which are overall are a fairly poor nutrient profile. So it's just tweaking products really, rather than substantially improving the quality of these products.
So going forward, how can consumers identify and navigate their way around ultra-processed foods?
Well, the best way of identifying ultra-processed foods really is just to read the ingredients list on packaged foods or fast foods if you can find an ingredients list. So I guess the broader message is look at the ingredients rather than the nutrient profile of foods.
What is the current focus and what will be the future focus of your research?
Well, around processed foods, there's various angles that I'm currently exploring. One is the strategies being used by food companies to re-engineer and remarket their foods. So that's one line of research. Also looking at some of the ways in which food corporations are shaping scientific research through their funding and other ways of shaping scientific knowledge and also dietary guidelines and dietary advice. And also looking at some new products that are coming online, things like the alternative proteins and so-called fake meat products and the nutritional quality of these products and how they're being marketed.
Gyorgy, what is the role of academic research, including social scientists, in unpacking these ideas?
I think there's a real need for interdisciplinary research in all these areas. I myself am a social scientist, but I am working with other scientists and nutrition scientists, also food scientists, to explore both the character of these foods, their composition, their health effects, but also linking it up to the strategies, the marketing strategies, for example, of food companies, and exploring the way different types of policies and regulations could actually bring about a healthier food supply. So there's really a need to connect up the dots between these various aspects of the food system, and that really means having different disciplines working together.
Thanks, Gyorgy. It's clear that there are various complex and interrelated political, policy and health-related issues regarding ultra-processed foods. Thank you for spending time with us exploring this fascinating and most important issue. And thank you, Gyorgy, for sharing your expert opinion and insights into ultra-processed foods. Thank you and goodbye for now.